This episode of Inside EMS is brought to you by Lexipol, the experts in policy, training, wellness support, and grants assistance for first responders and government leaders. To learn more, visit Lexipol.com. That's Lexipol.com. As we know, every Friday it's time to go Inside EMS. I am your host, Chris Saballera, and you can see him there if you are watching us on YouTube. He is the man of the hour, too sweet to be sour. The ladies know he's
the ladies know I have the power.
Kelly Grayson, how you doing, KG?
I'm good, brother. I'm good. Doing my thing, saving lives, stamping out disease and pestilence, molding young minds.
Yeah, how's that going for you?
There've been some career hiccups, but things I'm getting through. Still doing my teaching stuff, just not in the form that I had anticipated. So it's all good.
But you've been constantly one of the foremost EMS educators in the United States all the years that I've known you. You would think you're probably getting ready to retire now, aren't you?
Well, I'm looking for my sunset career. I'm feeling these paramedic knees, man, and I have partners that call me sir. Because I'm old enough to be their dad, and that's just right. Absolutely sucks.
Not even an older uncle anymore. This is
I'm not the fun uncle anymore. I'm just like dad. Oh, yeah.
So when we think about this week's show, there's just so many things to talk about, so many things to look at, and one of the things that we're starting to see more and more now are these, TV ads about weight loss drugs and Ozempic.
Mm-hmm.
I'm sure that we can find a lot of our friends who are on these or semiglutides that are really using them for weight loss. And I know quite a few people that have lost considerable amount of weight. I mean, 70s and 60s and 80s.
Mm-hmm.
And so there seems to be some weight to this, that people are starting to use the Ozempics and the semiglutides to weight loss, to have weight loss. But we're going to probably start to see these people more and more, Kelly, on our truck, and probably thought that it would be time to, chat about it. And of course, our peer, Jonathan Lee, who we've had on the show, he's the white whale, he's the one that we've tried to get on the show forever. I think we've only gotten him once, but he's really good about understanding of the pharmacology when it comes to the things that are in our career field. And he does a great article about understanding Ozempic. And, he starts off the article, which I thought was very, very entertaining. Ask your doctor if Ozempic is right for you, right? Because we see these ads on TV all the time, but do we really understand what they are, what they were for? But, Kelly, if I go ahead and ask you the question, we've used the term semiglutide before and, in the show, but what exactly does that mean?
It stimulates a receptor in the brain and in the digestive tract that without getting too detailed in it, and Jonathan does a great job of outlining its mechanism of action in the article. But basically, it is used for type 2 diabetics who have poor insulin control using metformin. So they take Ozempic and by stimulating this receptor, not just Ozempic, any semiglutide trade name, it stimulates this receptor that in turn increases production of insulin and decreases production of glucagon. So by that method, it actually lowers blood sugar, even when metformin isn't useful in doing that. But the rapidly growing popularity of this drug is really attributed to its weight loss effects. And that's where it's really taking off. And it's believed that semiglutide drugs stimulate some receptors in the brain that suppress your appetite. Not only that, but you process food, gastric emptying a little easier. You digest things a little better with the one problem with this drug that people have run into. I won't say a problem, side effect. And sometimes they get a little constipation. They have some GI distress if they don't, until they get used to it. But the weight loss is where this thing is really, really taking off.
Yeah, one of the things that we think about is, we always talk about insulin and the effect that sugar has on the body. And of course, sugar is in everything we put in our mouth. And I think that that's a
Yep.
big problem. When we talk about the glycemic index, a lot of the diet, programs that we see out there really kind of work on the glycemic index. And just for visual, and the people that are watching us on YouTube, we have a, kind of a parallel pattern. And as we add sugar, we, that insulin side just keeps, the sugar side just keeps rising. Then as that sugar drops, it tells us that we're hungry and we eat more, and that sugar never gets back to the neutral position. These are the stores of
Yeah.
of what we need to start to work on. So if we now stop eating the sugar and it allows us now to work on the stores, we'll start to lose weight. And I tried this about 3 months ago. I just stopped eating raw sugar. I have
Yeah.
coffee every morning, and I put a couple of teaspoons of sugar in it, but I stopped the cakes, I stopped the cookies, I stopped the soda and those
Hmm.
types of things. And in the past 3 months, I've lost about 17 pounds just from not eating sugar. And
Yeah.
I got to tell you, I feel a little bit better. I feel a little bit
Hmm.
more energetic. When I eat, I don't eat as much. I get full a lot faster, which is interesting as well. But now, what we do, Kelly, as we start to talk about the semiglutides, this was really a drug that was used for diabetics, right? To control
Yep.
their blood sugar.
Yep.
And what they're finding is it has a lot more of weight loss. And it's a lot of things with drugs. I mean, when we talk about Viagra, when
Hmm.
Viagra came on the market, it was used for blood pressure. And
Yeah.
then
It's
all of a sudden, there's a side effect, or there's maybe a primary effect that people are starting to use now. But there's a lot of drugs out there that came on the market for something, and now we're using it for something else. But
Yeah, Rogaine was supposed to be antihypertensive, and Viagra was supposed to be a long-term anti-anginal.
I
So,
didn't know that about Rogaine.
yeah, Rogaine was supposed to be an antihypertensive agent, and when they were looking at, and still is actually an antihypertensive agent, you can use it for that. But when Viagra was being researched, they're questioning all their study subjects, and in their surveys, have you noticed any unusual side effects? Guys like, well, yeah, as a matter of fact. So I go, well, you know what? We have competition for long-term anti-anginal. We got Emder out there that we've got to compete with, but no one's got a magic boner pill. Perhaps we shift our marketing and our focus on development of this drug. And lo and behold, we have the
Yeah, there's no joke to follow
folks like,
there. We know what you're talking about.
yeah.
But so when we think about these from Ozempic or semaglutide, what are the indications, Kelly, that you would find the use of this? Because they're going to still use it for folks that have diabetes, yeah?
Yeah, that's what its main use is glycemic control in type 2 diabetics who are poorly regulated with metformin alone. And that's its indicated use. The weight loss is actually an off-label use, and it is prescribed quite often. But since it's an off-label use of the drug, your insurance is not going to pay for it. You're paying for Ozempic out of your pocket. Now, I have an advantage here, and that my physician is, I don't take Ozempic, by the way, we'll get into that, but my physician is licensed in both Canada and New York, and it's 5 miles from the Canada border from my house. So what costs $1,200 a month in the United States costs $230 a month in Canada. An Ozempic prescription costs $230 a month in Canada, which make it affordable. I have yet to fill that prescription. I tried the samples that he gave me, and they probably did work, but I was already having success in losing weight without it, and so I just didn't keep it up.
So did he
But
give it to you? Did he give it to you for weight loss, or were you having trouble
yeah,
with
that's
sugar?
exactly what he gave it for me.
Really?
I'm lucky in that I was horrendously out of shape, but my cardiac function was fine, other than the great big humongous clots in my lungs that nearly killed me. My cardiac function was fine. No damage was done in the PE to my heart, and little long lasting damage to my lungs. And my cholesterol is good. My blood sugar is good. And I have good control of my blood pressure. I'm hoping as I lose more weight, I can get off the blood pressure meds and get off the Eliquis that I'm taking after the PE. But I was otherwise healthy except for that one major event. I had far healthier than I had any right to be at the weight I was. So I didn't need the med to control my blood sugar. I'm not diabetic in any way, not even close to being pre-diabetic, but he gave it specifically for weight loss. And I tried it. I could never be diabetic because I hate injecting myself. So I tried it a few times and took it for a month. And,
Do you
like I
feel like,
said,
I mean, did you get
I don't
any
know.
weight loss or anything? But how could you tell if you were doing
Yeah,
all
I
the
was
other
already
stuff?
losing a bunch of weight, since October, since Halloween of last year, I've lost 100 pounds and I've lost 90 pounds. I'm close to 100 pounds from my heaviest weight back in 2018. But so I'm doing just fine.
Oh, interesting. I didn't know you
Without the
were,
Ozempic. But the
I didn't
thing
know you
is,
gave it a go.
we have an obesity epidemic in EMS as well. Did you get skinnier when you started on an ambulance, Chris?
No, I don't think so. But I do think that the running around allowed me to be more active than it did than it does now, right? I mean, because
Yeah,
you're up and
but
down the stairs, but
yeah,
it's all the fast food, it's all those things that.
that's right.
And when we think about this from a standpoint of managing diabetes, Jonathan puts in there about 3 pillars, which I think are important that we need to understand
Hmm.
that when it comes to type 1, type 2 diabetes, it's very important that we manage blood sugar. How many times have been on calls of people who are hypoglycemic because they haven't figured out the sliding scale or they haven't
Yeah.
figured out how to manage, right? And then we talk about blood pressure, we talk about cholesterol. He does put a 4th pillar in here, which I think is important, and that's cardiovascular and kidney benefit. Because one of the things that we always have to think about with people that have diabetes, it's glaucoma, blindness, kidney failure. Now they're on dialysis. And it really now comes into one condition can now develop into multiple comorbidities, which now cause challenges. How many people do we
Mhm.
know that started off with diabetes that are on dialysis 3 times a week, right?
Yeah, well, that's how the diabetes eventually kills you.
Yeah.
Not by your blood sugar doesn't kill you. Your blood sugar kills every other part of your body. It attacks your nerve endings. It attacks your eyesight. It attacks pretty much every body system along down the road if you don't control it. There are plenty of people who live full, long, healthy lives, professional athletes who were type 1 insulin dependent diabetics, but they learn how to manage their blood sugar well. But if you don't manage your blood sugar well, or you're having problems with that with your current medication regimen, it has a lot of systemic effects. Many years back, I developed a neuropathy in my left leg that I thought was, my physician originally thought that it was diabetic neuropathy. He said, quite frankly, Kelly, you got the body habits for it. And I'm, well, yeah, I do. And he called a physician friend of his, got a curbside consult, and the guy said he described the symptoms, and the doctor said, let me guess, hefty boy, big belly, but otherwise healthy. So, yeah. And let me guess, the pain is on the left side, on the lateral aspect of his leg from hip to knee, and only that area. And he said, that's it exactly. He said, oh, okay. He has a neuralgia paresthetica, which wasn't a neuropathy at all. It was my big fat belly pressing on my lateral cutaneous nerve that
Oh,
just made it feel like my leg was on fire 24/7. It was excruciatingly painful. But luckily, I'm done with that now. Get heavy enough, it's numb. Start to lose weight, and it gets into when I lose a little bit of weight, it flares up, and when I lose enough weight, it goes away because we've been working compression of that nerve, and I'm at that point now. But it wreaks havoc with your nervous system, with your kidneys, with your blood pressure, all of these sorts of things. And semiglutide drugs like Ozempic and Wegovy and the other trade names are useful in managing that. And if you
yeah.
don't manage it, you're not going to live long.
Another thing that I think is working well here is that this drug is also associated with a mild decrease in blood pressure. You may be controlling your blood sugar, but you may have challenges with your blood pressure.
Mm-hmm.
And of course, when you start to mix all those drugs, are they really doing? But you now have one drug that may be able to reduce mild hypertension. And I think that there are a lot of things. One of the things that I hear, though, and I've not been able to research it, and maybe the folks out there can help us out, that once you stop taking this drug, though, it puts everything back to the status quo and you start to gain weight again. And, we're going back here now to 2021 where the FDA approved semaglutide for weight loss.
Yeah.
And, people are starting to use it more and more. And, the average is about 12.4% average weight loss over the course of a year. So let's say if I'm 250 pounds, I'm looking at about what, 65 pounds,
Mhm.
55 pounds that I could lose. I mean, it doesn't take you a day
Yeah.
to lose weight, and a
No.
lot of people think they're going to diet and they're going to lose this weight fast. How long did it take you to put this weight on to get to a point of saying that I need to lose weight? It's almost
Yeah.
double the amount of time to take it off than it did to put it on.
Yeah. Yeah. And, I think that if you're using semaglutide drugs purely as your only means of weight loss and you get off of them, sure, you're going to rebound. I think that's far less likely if you're doing the other things necessary for weight loss and a healthy lifestyle, and you're merely using semaglutides as an adjunct to that to help you get started or to help you maintain. But bottom line is, if you expend more calories than you consume, and what you consume isn't really dense in calories like high carb foods are, you're going to be fine. Semaglutide drugs may help you with that. But if you're keeping up the healthy eating habits and the healthy lifestyle and staying active and fit, not going to be a major problem for most of us. And I think that, for us in EMS, that's the thing. You said that, you kept fairly fit, you ran around a lot in EMS, but it's not as active a profession as many people think. Yeah, sure, you have moments of extreme exertion where you're really, really exerting yourself, but you don't maintain those moments of exertion long enough to really call it exercise.
Yeah.
It's what is the old saying, every shift is 23 hours of boredom interspersed with moments of blind panic.
Mm-hmm.
And that's not a healthy lifestyle. Plus you adopt the convenience store diet, you eat at odd hours, you eat at odd intervals. So you eat, something nuked in a microwave at the 7-Eleven. Those are horrific eating habits, and it teaches your body to just hoard calories and food. And you wind up gaining weight that way. And there's a lot of fat people in EMS, myself included, that are proof of that.
Yeah.
But
Yeah.
if this
Jonathan,
helps.
yeah, Jonathan does throw three considerations in there for
Yeah.
pre-hospital considerations. Number one is check the blood sugar, right? Anything that we're going to give
Mm-hmm.
Kelly is going to cause a decrease in blood sugar, and hypoglycemia could be part of this. How do you now, if we find a patient that's hypoglycemic, how do we now weigh the fact that that's secondary to an Ozempic or secondary to just a diabetic reaction to not taking your insulin, or not monitoring the scale or whatever that is? I mean, does this open up Pandora's box to find a can of worms? You just treat it the same way.
I think you treat it the same way if you're treating acute hypoglycemia like we should be treating it these days, and not with a big whopping bolus of D50, which is going to promote an insulin dump, and your patient will bottom out. They have that rebound effect. But most EMS agencies are approaching, if you're not, you really should, approaching treating hypoglycemia with a more measured approach by giving a bolus of D5 or D10 and titrating the administration of dextrose to getting the blood sugar back up. And that's gonna have a better long-term effect for the patient. It doesn't take appreciably longer to bolus a 250 milliliter bag of D5 or a 100 milliliter bag of D10 into someone. This was a 500 milliliter bag of D5 is the same as a amp of D50. It's going to do what you need it to do, and it doesn't take additionally longer, and you don't have a spike in blood sugar. So I think if you're taking a measured approach to treating hypoglycemia, or if you just say, okay, the blood sugar is low and they're capable of swallowing, give them oral glycemic agents and make sure that they can eat a regular stick to your ribs meal afterwards, going to be fine. I don't think it's going to be that issue. But if your idea of treating hypoglycemia is just give them an amp of D50 and take them to the hospital, or get a refusal and walk away and nothing else, you're going to have some problems.
Right. He also puts number 2 consideration is don't ignore GI symptoms, Kelly.
Yep.
What are we talking about here?
Diarrhea, nausea, vomiting, diarrhea, constipation. You know, this drug, not only does it affect your appetite, but it also affects the gastric emptying and these sorts of symptoms. And it depends on people's bodies react to that different way, but quite often diarrhea is a pretty common symptom. Nausea and vomiting, constipation is less common, but all of these GI symptoms are not uncommon with taking semiglutide drugs. So if GI distress and GI upset and diffuse abdominal pain, cramping, those sorts of things, if they're showing GI symptoms, one of the first things you ought to be doing is, okay, what kind of medications do you take? And we do our detective work by looking through that Walmart sack full of pill bottles, or in the case of semiglutides, probably looking in the refrigerator because they need to be refrigerated, and looking for these drugs. And you know, symptomatic relief, and if the diarrhea and stuff is extremely bad, of course you're gonna worry about dehydration. But we would do the same things that we do for any patient with similar GI distress in the field. But that might help you with your differential diagnosis, knowing
Right.
what these drugs that they're on.
And that's a good point when you talk about the differential diagnosis. We've got to be able to talk ourselves into a condition and not talk ourselves out of it. And then number 3, Jonathan talks about check the drug label, relatively few examples of semiglutide overdose. However, recently a number of unintentional dosing errors occurred when the drug was not provided by the way the manufacturer said. But, you know, this is an interesting topic, Kelly, and I think that we're going to start to see more and more people. And are they going to be forthcoming like they weren't with Viagra, right? I'm going to give you nitroglycerin here, and if you're on Viagra, there's going to be a problem. But I think that we have to be able to use our assessment skills. I think we have to be able to determine that we're going to see more and more of these. I think more and more of our folks that are sitting 18 inches away from us are going to be using this drug. You know, more power to them. If there's a way to help boost weight loss, if there's a way to kind of help people gain more confidence, more power to them. But we just have to be able to be educated here, Kelly. So we know that if we're going to see patients that are taking this type of medication, how we can deliver the highest quality of patient care we can. But go ahead and give us your closing thoughts here.
Yeah, you know, and I think the overdose risk is minimal, although there is potential for overdose with any medication we take. But typically these semiglutide drugs, I know Ozempic and Wegovy are auto injectors, and you dial the dose in. So you merely dial in the dose, firm pressure into your glute or your quadriceps, and let it inject. Really hard to mess up the dosage unless you're mucking about with it, or it's provided in a non-official form. So, you know, be aware of it. But as far as using semiglutides, know that this is an increasingly common drug in America and in North America, and you need to be aware of what it can cause: the GI upset, the hypoglycemia, and be prepared to include that in your differential diagnosis when dealing with those things. And if you're an EMS or one of our listeners and you're having problems with weight loss, consider asking your doctor or pharmacist about a semiglutide drug, because it can be beneficial. It can help you with your weight loss and help you along your fitness journey. But hey, that's what we think. We'd like to hear what you think. Are you dealing with patients who have adverse side effects of semiglutide drugs in your area? And if so, what were they? How'd you deal with them? We'd like to hear those thoughts at the show at ems1.com. And for myself and co-host Chris Cebollero, thanks for tuning in to Inside EMS. We're going to catch you guys next week.